Good evening. Welcome to Tulare County Voices at 210. I will be your moderator this evening. My name is Paul Hurley. I'm a retired journalist, was an opinion page editor at the Visalia Times Delta for a number of years. Tulare County Voices at 210 is an outgrowth of a monthly forum that we conducted at 210 for more than 10 years. And we are resuming that now. Unfortunately, we are not being able to do it in person. We actually did have a couple of in-person forums at 210. But then the COVID spikes came again. And so we've retreated indoors for this forum this evening. That's kind of ironic because the subject of our forum is the COVID-19 pandemic. Tulare County Voices at 210 is co-sponsored by my former employer, the Visalia Times Delta, and by First Presbyterian Church, which owns 210. And we're always grateful to First Press for co-sponsoring these forums and supporting this public dialogue every month at 210. So in a couple of weeks, we in Tulare County and in the nation will be observing the 2-year anniversary of our struggle against the COVID-19 virus, the pandemic that has wreaked so much problems and severe tragic consequences in our nation for 2 years. And it's disrupted just about every aspect of our daily lives. We're here to assess what's happened in those past 2 years, not so much as to go over old ground or dig up a lot of history, but into try to figure out how we have addressed the pandemic, what's happened in our communities in response to that, and how we can prepare for the future. To help us do that tonight, we're calling on a number of experts in key elements of our community. First of all, and I'm not sure if on your screen this is the order it is, but this is the order it's on my screen, is retired business owner and community activist Lolly Mahano. Lolly's very familiar in Visalia and Tulare County for her work for literally decades on behalf, especially the underserved community. And we really want to hear from her tonight about how the pandemic has affected that community. Next on my list is the CEO of Kauai Health, Gary Herbst, a friend of mine, a fellow Rotarian, someone I know well, and someone I've had a lot of sympathy for in the past 2 years because he has really had a really difficult time obviously as the head of the largest healthcare organization in our community in addressing the COVID-19 pandemic. We want to hear from Gary about what he thinks Kauai Health and our community has done well, and maybe what we could have improved on, and what it looks like as far as consequences in our future for public health care. Next on our list, Health and Human Services Agency spokesperson Tiffany Swartout, and Tiffany's organization has been tasked with addressing public health concerns and especially how to keep the public informed of what's been going on in response to the COVID-19 pandemic. And we're going to want to hear from you, Tiffany, about what do you think? What communication has worked best? What hasn't worked? And what have you learned that's going to help us in our community to do better in the future? And last but not least, certainly not least, the interim superintendent of the Visalia Unified School District, Doug Cardoza, another person I have had great sympathy for over the last couple of years, and especially recently over the last couple of months, because obviously there's been a lot of friction that's been generated as people have different ideas of the approaches to addressing the COVID pandemic, especially in terms of how we protect the health of our children, but also ensure the highest quality education that we can have amid those protections. So As I said, we're gonna explore what has gone right and what has gone wrong, or what we have learned. So I'm gonna start with Gary Herbst about what kind of precautions, Gary, have worked for Kauai Health in response to the COVID-19 pandemic.
Yeah, thank you, Paul, and thank you for having me here tonight, and welcome to my fellow panelists here. Um, I would have to say that on a global and national basis, I'm not certain that our precautions have been all that effective. I mean, we've had what now over 6 million people have died of COVID worldwide, approaching 1 million if we haven't hit that already in the United States. We certainly have been much more fortunate at Kauai, and obviously as a large healthcare institution that's very focused on infection prevention. I wouldn't say that we were um, well prepared for this pandemic because it did hit us hard. We have 5,100 employees, and almost 2,700 of them contracted COVID over the course of the pandemic. I would say most of them contracted it outside of the hospital, but in the early stages of the pandemic, when personal protective equipment was very scarce, things to desanitize equipment and other surfaces was very difficult to come by, and so the precautions that we would normally put in effect, it was very difficult to execute them effectively because we just couldn't find the supplies and the material to make that happen. So we did lose 4 of our employees, passed away from COVID, and one of our providers as well. And so we're deeply saddened by that. But I don't know if these lockdowns have really worked. We had to shut down surgery multiple times just to prepare in case of a COVID surge. So I don't know. I think the jury's still out in terms of just how effective those precautions were. Again, I feel very fortunate that our workforce has managed to, make it through these 2 years, and they're incredibly exhausted, but they keep coming every day to take care of our community, and just incredibly proud of them.
Gary, let me follow up on something you said there. That you have 5,100 employees, and 2,700 of them had contracted the virus at some point over the last 2 years. That's well over 50%. It's in fact, I think it's more than 60%. I'm not that good at math, but would you have anticipated that 60% of your work staff would have gotten sick from this 2 years ago?
No, not in my wildest imaginations would I have thought that. But then again, when the virus first arrived in Tulare County in March, we were all anticipating that it'd be here for a couple months, and our hot summers would make it disappear like the flu generally does. So no, I think we're all rather taken back by just how transmissible. What's been really interesting with this Omicron surge is we've had hundreds and hundreds of new viruses or employees that have contracted the virus. 75% of them are fully vaccinated, some of them having even been boosted. So definitely the different variants, the surges that I think we're on our 4th surge right now. Yeah, it's definitely had an impact, and healthcare workers have not been immune to this virus.
Before I move on to some of the others with this same question, how have your procedures or your policies changed in response to that? I mean, to know that almost 60% of your employees got ill, and I presume almost all of those would have had to call in sick and miss work at some point during then.
Yeah.
And you're in healthcare. I mean, it's pretty important that your employees not spread any illness to patients and fellow staff members. So what have you already anticipated is going to change your procedures to address that?
Well, certainly we were caught flat-footed in terms of the availability of N95 masks. I mean, we might use a single box of N95 masks in a single year,
Yeah.
protecting against patients that might have measles or tuberculosis, but they're just not something that we keep in inventory.
Yeah.
And now we're stockpiling it. We're keeping months and months of N95 masks and gowns and gloves and face shields and all the PPE that essentially became standard for taking care of not just COVID patients, but pretty much every patient. Those are much more available now, and again are really being kind of stockpiled. But the thing that made it really difficult is while our employees exercised great precautions while they were here at work, and they were very compliant with all the precautions and the rules we put in place, they are human. And then they would go home and they would doff their PPE and try to live a normal life. And unfortunately, they're in the grocery stores and, working with their kids, and they have families. And so they just became just like everybody else. They might have been the superheroes here at work, but when they went home and took their capes off, they became just as vulnerable as everybody else. So
yeah, and you can't control everything, especially when you're out in the community. Let me move on to Tiffany. And Tiffany, I apologize. I got your title wrong. I warned you that I would. You are HHSA, Tulare County Health and Human Services Agency's Public Health Manager, correct?
Yes.
Very good. And, would you mind pronouncing your last name for me, just so I don't butcher that too?
Yeah, it's Swarthout.
Swarthout. Okay, Tiffany, thank you very much for being patient with me.
Yeah.
I'd kind of like to want to direct the same kind of questions to you. Now, your agency was tasked with keeping track of the virus, determining how severe it was and how it was spreading, and not so much what you could do to prevent it, but how you keep the public aware of it. What worked and what didn't for you?
Mm-hmm. I think early on in the pandemic, when people were really abiding by quarantine and isolation procedures, when they were positive and exposed, that's when we were seeing the most effective use of those tools. As things progressed, people understandably got restless. If they're in a workplace being exposed multiple times, quarantine can get lengthy. And if you're at home and your house members are getting it, it just extends your quarantine over and over. But at the end of the day, for us, when we seen vaccinations increase, we seen the huge decrease in 2020, in spring of 2020, until Delta hit us, in individuals who were positive for COVID-19. Then when we mask, so they call it the Swiss cheese method, when we mask, that's another precaution that's very effective. So there are people who, even in our workplaces and our families, if we're masking around them and they end up being positive, even in my house, my kids got COVID and I abided by everything except for isolation so that I could care for them. And I did not end up being positive. So those are like the real life examples of vaccine, boosters, making sure you're socially distancing and masking, how it can have a really positive impact and help prevent the spread of COVID-19. In addition, early on in the pandemic, people were taking those contact tracing calls where it was like 70% of our positive cases were being interviewed. But over time, that number has decreased significantly. So that's one of the other things that was really important early on in COVID, that we've seen the community's, participation in wane. But with regard to messaging for the community, I think that one of the things that did not work is how quickly this virus shifted and mutated. And when guidance would be provided by the CDC or California Department of Public Health, people took that as this is now the status quo. And I think that as part of messaging about health issues, we really should have framed it as this is what we know now and this is what is true now, so that we created the space for things to change, because it has evolved so much. And the community's education around health and health related issues is part of that. So if they don't understand how things can evolve and variants can come and how each of those will lend to a shift, if we would have framed that at the beginning, I think that the community and the public would have been more receptive to receiving changes in information.
Yeah. I got a question from someone who's following this discussion online. Why is Tulare County's vaccination rate so low compared with other areas of the state?
Well, Tulare County has a lot of unique challenges, such as access to care. Many of our rural communities don't have regular access. It is something that we've worked on. And in some of our most rural communities, we have vaccine events every week, 1 day a week to offer the vaccine. But I think that part of this is there are individuals who are never going to choose to get the vaccine. And so our vaccine rates are never going to shift in that direction. All that we can do as the health department is make sure that we're providing evidence-based information and statistics to inform them the importance of vaccine and the decrease in serious illness as well as hospitalizations. So in our community, it's just there are a lot more people who are going to choose not to get vaccinated, and that's their right. And I think that as the health department, our role is really trying to people who are on the fence, convincing them and providing them information rather than us spending time on people who will choose not to get vaccinated.
Yeah. How much of a problem was disinformation, Tiffany? And what did your department do to try to address that?
Yeah, I think very early on, that was a huge concern. If you look at the data, the vaccines became widely available at the end of April, beginning of May in 2020, and we expected to see a flood of people come and get vaccinated. And in Tulare County, it was at that point that we seen a decrease in vaccine event attendance. So that's part of it, is that people who wanted the vaccine got it early, and it wasn't like they were waiting to be eligible. So early on, there was a thought that people were being chipped, and now it's been well over a year that the vaccine has been available. And so those concerns have really waned. And the people who were not getting vaccinated last May, June, July, they were negatively impacted by Delta or have lost family members. And so those are the types of things that have convinced people to get vaccinated. But again, misinformation early on was a big issue, and the people who already made up their mind and, respectfully are not going to change their mind about the safety of the vaccine are still, taking in that misinformation.
Is it a matter of just accepting the fact that there are certain people that just are not going to listen to the information you're going to give them, and are basically not going to, behave the way you would prefer that they do?
Yeah, I think that, all we can do is make information available. We are not in Tulare County. Our health department is not in the business to strong arm anyone into anything. Yeah. And so our position has always been very conservative. We are never stricter than the state in any of our mandates or the guidelines that we've put into place, because we are respectful of the wishes of our community, and all we can do is make the information available.
You didn't really have that much, maybe should say, violent blowback, a lot of extreme protests, a lot of people, getting up and screaming in meetings, which has happened in other parts of the state. Mm-hmm. But that really didn't happen so much as far as the Tulare County and Tulare County agencies. School board might be a little different. We'll talk about that in a minute. But that you seem to kind of dodge a bullet there.
Well, and I think that lends to the approach that our health department in the county of Tulare has taken, where we're just aligning with the state. We're not doing anything more drastic. And we are demonstrating to our community that we are respectful of their choices. So I think that because we haven't tried to strong arm businesses or individuals into getting vaccines or mandates that are considered extreme by our community, has really put us in a position that we have not had any of those types of protests at our events.
Yeah. Okay. Let me segue here to Lala Maheno, because Tiffany brought something up about the profile, shall we say, of Tulare County. It's an area that has a high incidence of poverty. A large percentage of the population is non-English speaking or not documented immigrants, and a lot of farm workers who aren't necessarily in going to a clinic every day and around the fields probably 6 days a week. Lolly, I understand that you and a group have taken to bringing healthcare out to the fields to some of these workers to make sure that they get information and in some cases get vaccinated. Is that right?
Yes, we, first of all, let me say that I already had a working committee, me and some other people. We had a working committee because we were, for the last 20 years, we had been working on a health conference for farm workers. So we kind of had a structure. We knew where the people were and where we could go and what we could do. So when all this happened, we didn't know what to do. We were getting ready to do another conference, and then we decided not to. So then we said, okay, and I thought about it. What do we do? How can we help? Well, one evening I was wide awake and I said, the committee, let's use our committee and let's go out there as we're going to have the conference and educate the workers as to what's happening, what can they do. And my biggest concern was, what do they know about this? What have they heard about this? And so one of the problems we found was exactly that they knew there was a problem and the farmers had told them there was a problem, but they didn't know what to do because they had to work.
Yeah.
And I was telling Jim earlier is that one of my concerns was that farm workers had to be treated because they are the ones who are doing our fruits and vegetables. And people have to eat throughout the country, throughout the world. And, part of our job, the committee, was to also educate the public through media that the farm workers had to be treated more or less as essential workers because they had to provide the food for everyone as we were getting sick. And so I had a huge learning curve as to how do I handle this? I have this huge group of people working with me, but I've got to train them, but I got to train myself. Who's going to train me? So nobody trained me. What I did was I started watching the news and reading different sources, not only one. I don't believe in just one source. And so I started educating myself. Okay, what do I do here? Then I started looking for Spanish-speaking materials that could help us with terminology. I didn't know pandemic terminology in Spanish, and I had to learn it. I had to, work with people in Mexico so that they could tell me certain words and how to explain pandemic and how to explain certain things to them. And so I had to educate myself tremendously at the same time this was happening. And I think Tiffany alluded to it, was that everything happened so fast and we were barely training and everybody was already dying, and so we had to go directly to the fields and catch the workers there because they leave there. It was during the grape season when we started doing all this. They were leaving the house at 4 a.m. Mm-hmm. So we couldn't catch them there. And my other big concern was the workers, like a lot of they travel in groups, with rides. They go in vans. they go in like 10 in one car, they all travel together. So I figured, oh my gosh, they're all going to get sick here, everybody traveling together. So there was just a lot of issues, guys, a lot that we had to educate ourselves on.
Yeah, it sounds like it sounded like on the job training, kind of making it up as you go along, huh?
Yes, because once what I did first was go to a field and find out what their needs were.
Yeah.
Okay, tell me, guys, what do you need? Well, we have to work. No, aside from that, what do you need? Well, they could not go to the sites. I mean, Tulare County had wonderful sites going on. They couldn't go over there. It would take hours. Remember the long lines we had? They couldn't do that. So they decided not to do that. So they remained like that for a long time. So then what we did is we started having our own vaccination events in the rural communities, way out there. And then we would do canvassing. We would go to the immediate geographic area that we were serving, and we would go to their homes, find out, okay, where are you guys at? And then we would find out how many were in that home. We're still doing it this as of today. Tomorrow we have a very big event, and today we were in Tipton. So we have, in order to address a rural county, Paul, the way you brought it up a while ago, is that we have to go to them. They have transportation issues. They have the language. They have fear. They have trust. They have, like you mentioned, Paul, the poverty, the barriers. They have, like a lot of people say, well, how come they are so low in vaccination? Say, wait a minute, guys. We have nicer homes. They don't. We have cleaner homes. They don't. We have better drinking water. They don't. In the rural community, they have very bad drinking water. So on top of all those barriers, here's COVID. Okay, and then as people were dying, and I learned this I went to a funeral directors meeting, and that kind of made me nervous, but I had to listen to what they were saying.
A funeral
directors. Funeral directors.
Funeral, yeah.
Funeral.
Funeral home directors, yeah.
Funeral home director. I'm sorry. I don't know.
No, I just want to make sure I understand who you're talking about. I do now.
Yeah, I know. I didn't. Okay, anyway.
That's an unusual approach. Why did you do that?
I had to do some research, and one of them told me that when the farm workers were dying, and I already knew this somehow, I found out that they were having their funerals, their services in their homes out there in the rural community. And they were all, like in our culture, when somebody dies, everybody comes over. Everybody you can think of. It's like if they're in the hospital. I think Gary knows about this. In our culture, everybody goes to the hospital, like tons of people. Same thing with the funerals. And they were coming out the next day, the next 2 or 3 days sick from this funeral. And that's what the funeral directors told me is like, okay, they started burying the ones who were there before.
Yeah.
We had to talk to them about that too.
Well, that's the way early on that everywhere across the nation, things like funerals and weddings, christenings, bat mitzvahs, quinceañeras, they all ended up being gathering places, and then COVID breeding grounds.
Yes.
Did you encounter any resistance to the healthcare that you were offering to the farm workers?
It's very, very big, because they felt that there were some cultural differences, and that they would not be welcome in the clinics, because the experience has been, and me myself, I was a farm worker, our experience has been that clinics had not in the past been very welcoming to the poor, because there was no insurance, you name it. There were many reasons. But they know that there are a lot of clinics that do not really welcome them. And so they don't feel comfortable going. Like
Yeah,
in
okay.
our events in December, we had 1,100 people attend our December event in Porterville.
Oh,
We vaccinated 541. We
wow.
had to send 100 people to another clinic because the staff was so darn tired. They couldn't handle it anymore. So we had to send people away. We had lines and lines. And so we have very big turnouts. But I asked them, like yesterday, they were calling me again from out of the Tipton area. It's like, we need it, senora. We need the vaccines. And what I told them was, CVS, you can walk in there right now and get it, guys,
Yeah.
right now.
Yeah.
And they said, no, we're not going to go to CVS. No. We need to go, and this is what this guy said. I want to go where I will be welcome and where they will know that the reason why I'm dressed this way, dirty, coming from the fields, and it's just trust, okay?
Yeah.
And
Yeah.
but
That's pretty common with other minority groups, with other underserved communities too, of distrust of our healthcare system, really, because they have been victimized in the past. Well, Lolly, so what? Some of this has worked. What do you plan to use to keep improving access to healthcare for the farm worker community?
It's very well. It's been very difficult. Like Tiffany knows, I've been in meetings with them, asking for resources, and the county has been very generous with our committee. They have provided as much as possible to us, a little bit of funding, and then I had to fundraise. I had to look for money. I found, like $10,000 from Anthem Blue Cross. And then I found, and then I just won a prize from a group out of San Francisco for working with the farm workers. And they gave me a $25,000 check. So I turned it off. I said, yeah, I needed that guy. So I turned that
Just to celebrate.
Okay. And with that money, what I'm doing is I'm buying gift cards of $25. Because again, remember, we're dealing with a poverty area, and we're asking people to leave work early to come and see us. To them, leaving work is very serious because they could lose their job, or they're going to lose a big chunk of money that they need for that check to survive on. And so what I do is I try to find, right now, people are very nice with me. I ask them for lunch boxes for the children. They give us lunch boxes. I have a long list of things if anybody's interested. But I have to do my own fundraising. But the county has been generous. And so I'm a volunteer. I don't get paid for anything, not even for my gas. I don't want that. I want us to be safe.
Yeah.
And the whole city, because there's one more point I want to make so the community will know. Is that the farm workers, the people in the rural communities come to shop in Visalia. And they come to have their children in the hospitals in Visalia or in Tulare at the Adventist store in Porterville. I mean, they come to the bigger cities for services. So we need to keep them healthy, okay, for them coming here. And then the school children, they're very concerned about the school children. They want their kids in school. Okay, so it's a series of issues that we have been addressing.
Well, that's a great segue there, Wally. I'll be getting back to you, but let's talk a little bit about schools. Probably maybe the institution that has been affected most on a daily basis with everybody by this pandemic. 29,000 children a day attending schools in Visalia, and a staff of 10,000 people also all going to work every day. And the district was charged with keeping them all healthy and safe. Doug, you've probably got hit with just about every kind of solution or approach to this pandemic as it went along. Masks, vaccines, remote learning, other kinds of other kinds of distance learning, spaced out classrooms. You probably have heard everything. What didn't work real well for you, and then what did?
Well, the thing right off the bat, and someone shared earlier, I think maybe Tiffany, about early on how the protocols were in place and the contact tracing, the different things. Right off the bat, we were, the way the protocols were in place, we were quarantining, whole classrooms of kids, and so kids were being sent home, and we know that was impacting our community because now mom and dad can't go to work. The residual effect of these large, massive quarantines we were doing, and all because we were all learning and trying to figure this out. But it was definitely having a big impact on not just our kids and families and staff, but our community as well, for people to be able to work. So we did make some adjustments. I mean, I think in the first 4 days, when we brought kids back with masks, we had to shut down, actually in the first day, like 4 kindergarten classes. And then we realized real quickly, this is not going to be sustainable. So we made some adjustments. As we went through this, we immediately started getting hit with all these different other pieces that, schools support families with. Kids were used to having hot meals at school. And so when we shut down our schools and all kids were at home and online, we quickly found the weaknesses in our system. We found the inequities within our system, the families that had access and those that did not with technology, those that didn't have access to food. So, we were setting up places for kids to pick up food. And so it was one of those things that you never think about, and you don't really have all those systems in place. You never anticipate that. So we've learned that we have to be better at that. I think it's exposed many of the weaknesses and the systems and protocols that we have to change and policies in our district. And, one being really building out a network so that kids do have access to internet and all those pieces. If we ever have to jump back into a situation like this, we'll be much better prepared to support them. Over this last year or so, our goal is to keep kids in school, just like was just mentioned. Our families depend on that. And so we've really worked hard on that. And so with we've become better at being prepared. We were able to anticipate this last surge, and we knew we were going to be in a situation based on previous data that we're going to have 80 to 90 to 100 people out on any given day that we can't cover because our sub pool was being impacted. And so how do we keep schools open when we have nearly 100 staff that supervise kids and teach kids? And so we really put some systems in place, and it was kind of a whole team effort. And we had to have staff that's willing to do things they didn't sign up for, that they district office staff would deploy out on a daily basis to cover classes, to cover supervision. And so we've learned how to really utilize and come together as a system to keep kids in school. And we've been pretty successful. Our numbers today, we had, I think, 4 staff members out. So the numbers have really dropped off, and it's quite a celebration. We actually at a point now where we can use substitutes and have staff development. We actually have some extra substitute teachers. So that's a great sign. But through all this, we've really learned that we do have some equity issues within our system that we have to address. We were not prepared with PPE and all those things that were mentioned earlier. And we are in an area that I think we still only have about 60% of our certificated staff who are vaccinated. So having options for staff for testing and all of those pieces was very important. So the other thing we learned is, as looking ahead, you've got to have resources available. And so quickly manpower became an issue. It's become an issue with our whole community, not having a workforce to get the work done. So we've learned that we've got to have relationships with different agencies and kind of have people in our back pocket if we need to access other forms, other ways to serve our community and our kids. We've been fortunate. We put together systems to vaccinate and test and all those things so that we can get people back to work very quickly. So we know the impact it was having. by having a teacher have to be quarantined for 10 days and just because they were exposed. So some of the new guidance has helped us to keep kids in school. But it did impact our underserved communities, kids that didn't have access. So we had to really pull together on a regular basis to figure out how are we going to make adjustments? How are we going to get the resources we need from hotspots to, we ran around and we put up about 8 towers around the community to try to give people access. So it's been a kind of a knee-jerk reaction, unfortunately, going through lots of these challenges that we've been faced with. And so, we're taking note of those things that we've got to have in place and be prepared for this type of situation in the future. We're obviously much better prepared now if we had to toggle back to a situation where kids were at home. In fact, any kid that's quarantined now, they're able to Zoom into their classroom and not miss a day of instruction. It's not in person, but at least they're able to connect in with their current teacher on a daily basis and not miss out on that instruction.
What kind of things, Doug, will you continue to do or expand on that you started on this? You mentioned, for instance, that you put up a number of towers for increasing internet access. I presume that's what you're referring to.
Yes.
Access around the district, and you're also talking about the need to make sure that your underserved students receive the meals that they would normally be getting on a school day. What kinds of things will you keep doing, or maybe expand on in that light?
Yeah, so that's definitely a piece to continue to build out. I know our Tulare County Office of Education has reached out, and they're looking at possibly taking on the task of building out a large network across our county and interested in whether we hand over the 8 towers that we put up to be part of that project, but working with them to try to create access across the county is super important. What we have learned from this, some positives, there are some kids that really thrived on online type learning. And so we've started an online school. We have an online K-6 right now, and we're going to expand it to, I believe, K-8. And so it does serve a purpose even outside of these pandemic times. Yeah. We found there are some kids that do very well like that. We have families that want to travel and have the ability to support their kids that way. And so having those opportunities for our community are super important. We have those kids that didn't do well at all, that need the in-person instruction. And so making sure we have those opportunities for them, obviously, all the time. But there's different, we have an independent study type program, which is another approach, and it's a more independent approach. And some kids can handle that and do very well. Our online school, they meet with a teacher every day. They're basically online with a teacher each day. We've also started a program that I think will continue. It's an after school kind of a tutorial. So we have nearly 100 teachers that we pay in the evening to log on. There's a period of time that they can log on, and kids can go on to it's on our website, and they can go on and say, hey, I need math help. They can find a teacher that's supporting 3rd grade math or whatever that may be. And they can click on that Zoom link, and the teacher's on there live. Teacher may be on live and never get a kid tap in one evening, or they may have a dozen kids that tap into that support. So we've done that. That's been real.
You didn't have that before?
No, we didn't have that before. So that's just an added little thing that we've learned that we can do with Zoom. And obviously there's been a lot of money that's come to schools to support doing things differently in this time and supporting the pandemic and providing access for kids. So that's one way we've utilized some of that money. So I've run into parents actually at the county. One of the folks that work there was saying how much they appreciate that and how valuable that's been to their children. We'll assess that and see how much the usage was. And, even now we're taking a look if there are some areas that are not being utilized, and we'll probably cut some of that back. Yeah. But it's been a nice opportunity for our kids to get a little extra support.
It might be years, maybe decades before we really know how this episode has affected children's development. But I did want to ask you at that 2-pronged, question. What do you think was the effect on student learning in the short term while it was going on, and both for better and worse? And you've already alluded to a couple of those. And what do you think about the long-term consequences of what we've just experienced?
In the short term, we saw lots of different impacts. Like I said, we have kids that did really well. I think it still is determined by the adult that's in front of the kids on the camera. And so you'd have classrooms that did very well on Zoom, had a teacher that was very committed and engaging, and kids somehow got kids to turn their cameras on. And then you'd have other staff that struggled, and they'd have a screen of all black screens where kids they didn't build a relationship to a point where kids would even turn on their screens. They'd never even see their faces. And so
Are you saying a good teaching is good teaching, whether it's in the classroom or it's on a screen or on a computer?
Relationships, folks that build relationships, whether it's across the screen or whatever, we saw much more success with kids engaged. There was that intrinsic motivation that kids wanted to please the adult on the screen or the teacher on the screen. And we saw a lot more success on that. And when they didn't have that intrinsic motivation to get kids to want to open up, they didn't. So one of the things that, that's kind of good and bad, we're seeing that it pushed a lot of kids onto social media, really living on their phones. And so you're seeing some of the impact of that now is we're seeing kids will post fights at schools. So you're seeing some of that in social media. And so then you see this uproar in the community. What's going on at our schools? We've got all these fights going on. But the reality is our data is better. We've had fewer fights this year than we had prior to the pandemic. But now you're seeing all those fights. So the public's not used to seeing those types of things. And kids are, we've got kids that are fighting that as a social media challenge to get, they'll fight and want someone to video them so they can get, go viral on TikTok and things like that. So I think there's more kids because of being home and isolated or have been pushed onto social media. And we're seeing a lot of, it's becoming super challenging at schools. We have a policy not to have phones out at schools.
Yeah. But
that policy has been in place a long time. And so we went through a phase where kids were not really abusing phones and staff were using them before we were one-to-one with computers. Your math teacher would say, yeah, take your phone out. You can use it as a calculator. Or social science teacher may say, hey, look this up, Google this. And so it was being used as an instructional tool. And so kids got used to it. It was okay for them to have them on their desk. It wasn't okay for them to be talking on the phone or texting. And teachers would say, hey, you got to stop that or put it away. And kids would put it away. But now it's become, if you go anywhere, it's become an attachment for kids. And during the isolation, I feel like they use that so much. And that was a lot of their communication and the reward system that we're seeing that it's very difficult now. It's causing some challenges for us in schools. And teachers are not knowing that they're being videoed while they're instructing, or if they discipline a child or say something, they're being videoed. And sometimes that's taken out of context. The next thing you know, it's posted on social media. So I think it's a residual effect of all of this is what we're seeing with the social media and access to that with kids. So that's been a bit of a challenge. So we're working through that.
That's definitely be a longer term consequence too of all this, about how those devices for social media are being used and abused in classrooms and schools. What would you say, Doug, that you would have you definitely not do again next time for if this ever comes up again that occurred during the pandemic?
If at all possible, doing the AB schedule where kids only came for half a day.
Yeah.
That was not real effective. It was hard to get kids to log on when they weren't there. It still had an impact on our community. If kids were home half a day or full day, it still impacted their abilities to work. That was one of the things that wasn't real effective. But, it's hard to say. Everything we did was in some cases we had a 2-week window to figure out how to make these things happen, and we're still going through some of that where things are changing. We watched today the governor expecting some information about schools, but I think having meeting with our teams and having teams in place ready to attack all the different things that could possibly happen, from feeding kids to providing health care to having our technology in place. I think we've learned a lot from that. I don't know. It's hard to say that there's things that I wouldn't do, because it was one of those things that at the time it was the logical thing to do, and it was with the resources we had at the moment. So because we didn't have all the internet, the first thing we did is we printed thousands and thousands of packets for kids and set up distribution. So I would never choose to do that again, and we won't have to because we have other systems in place. But I don't know that there was anything that we really did that just like, oh man, that was a disaster.
Well, you do learn things. So I guess that would be my next question: is what kind of changes in procedure or policy are you considering in response to what you've learned from the last 2 years?
I think the biggest thing for us is it's really opened our eyes. I talked about the inequity, the equity situation, and it's made us stop and reflect on everything we do, look at our systems. When you start looking at schools traditionally, they eliminated a lot of kids, and not intentional a lot of times, but eliminated a lot of opportunities for kids. And so when we're making decisions or building out some type of a program, it's caused us to stop and think, okay, let's think about our kids that live out in Goshen, out in Idaho. Let's think about what it's going to require for them to be involved in this. And the parent side of things. So it's helped us to reflect and work on the equity issues across our district and stop and ask ourselves, what are the roadblocks for kids, our parents, our community before we move forward with building out a program or even building a facility, whatever that may be. And we did a thing where we were just looking at just that. What are the roadblocks, and stopping and making sure that we're removing barriers and roadblocks for kids. So I think the positive side of this, it exposed so many things that we were not prepared for. And in most cases, it was our underserved communities that were being most impacted. So it's really opened our eyes and helped us reflect on that and be cognizant of that as we move forward.
Well, that's a benefit. I want to address that same question to some of our other panelists here. But first, I want to let the audience know that you may submit questions through our chat room. I see that we've had a couple come in. I'm going to get around to asking those in a few minutes as we get closer to the end of our forum. So sit tight, don't go away. I promise you, we're going to get to you. And one of the questions actually is about the governor's announcement today. So that's something you can think about. But let me turn to Gary Herbst next. Gary, what kind of procedures or policies in Cahuilla Health might change or you consider changing as a result of your experience of the last 2 years?
Yeah. I was
having a lot more doctors and nurses besides that.
Yeah, and that's really, when you talk about the long-term consequences of this, it's kind of similar to Doug's answer, but this pandemic definitely revealed, a lot of the broken things in the healthcare system, and so we definitely need to rebuild our workforce, without a doubt. We've had this pandemic. I heard from the American Hospital Association that roughly 30,000 healthcare workers have permanently dropped out of the healthcare workforce, doctors and nurses and other clinicians that took early retirement or decided to go into, another profession. And that's been our experience as well. Our turnover rate among nurses and other clinicians is at an all-time high. We have today close to 270 traveler nurses, contract staff that are here, and we have over 600 open positions across the entire organization, the highest level it's ever been. And I think that's true of virtually every hospital up and down the state, across the country, and probably true of many other industries. I mean, we read every day
Same
about.
way in education, isn't it, Doug?
Yeah, exactly. Working with our schools, working with our high schools to get kids interested in medical careers. We are working with COS, Fresno State, working with a nursing school based out of Bakersfield that's interested in coming here to Visalia. So definitely, this has really, again, just revealed the fragile nature of our workforce. And that's probably been, the most challenging aspect of this entire pandemic. And it's really kind of ebbed and flowed, just the availability of staff. I think at our high water mark, we had almost 300 of our employees that were out on, a quarantine, a COVID leave of absence. And back in the early days, it was a 14-day quarantine. It's now dropped down to 7 days and even 5 days if you want to push it. I think today we have about 70 of our employees that are still out on a COVID leave. Just a few weeks ago, it was 289. And that's really what has a huge impact on our ability to take care of patients. So we literally, we not being mandated to, but having to shut down surgery because we simply don't have the staff, to support it. So we definitely, as a community, as an industry, as a society, have to reinvest much more heavily in developing our workforce, and not just the clinical workforce. All those that are in support services, EVS and dietary, and all the laundry and linen, the folks that help support the hospital operations. We definitely have a more severe shortage of doctors. So we need more medical schools. We need more residency slots to open up. And I would say we also need to start manufacturing more, PPE and supplies and drugs in the United States. We definitely found one of our biggest vulnerabilities is our dependence on manufacturing overseas. And so not being able to get N95 masks or drugs like remdesivir and, being at the mercy of other countries. So I hope this, as a nation, that we really, really think hard about how we need to make very significant structural changes to prepare ourselves for potentially the next pandemic.
That's a macro problem, Gary. That's a state and national, and it goes down to all kinds of things. Like you referenced, we need more medical schools. We need more people to go into those medical schools, and we probably need to improve the working conditions for the staff that you already have.
I will say, and Paul, I'll say to both the federal and state governments' credit, they have recognized this. I mean, that, there's always a silver lining to every crisis. And Doug was referencing definitely the sad things, the heartache outweigh the positive things. But there's a lot of things that have changed for the good. There are a lot of things that we will continue to do, like broadcasts like this. We've probably done over 100 telecasts with our community. We do weekly employee huddles. I hope the topic changes, moves away from COVID to other things. Telehealth, medicine, incredible how this pandemic has transformed telemedicine and made healthcare more accessible. But also the federal and state governments recognize that we have huge staffing shortages, particularly in the physician rank. So they're already creating bills, creating funding to fund additional, again, medical schools, fellowships, residencies. I don't think that would have happened without this pandemic. So that's been a positive change.
A couple of other of our panelists have mentioned the need to reach out or improve services to our underserved population, to minorities, to farm workers, many people in our community. This is an ongoing issue for Cahuilla Health. That was an issue before the pandemic. But did it it teach you anything about how to do that better, or what, how you might be vulnerable in that area?
Sure. Yeah, actually, I think pre-pandemic, you may have read that we launched a street medicine program.
Right. Okay. Yeah.
Yeah. So we actually have
Very successful,
volunteer.
by the way. Yeah.
Yeah, thank you. Volunteer doctors and nurses and other community members that go out, almost every day to the riverbanks, to the underpasses. They go out to the fields and they provide medicine right there, to the patients. We treat them with dignity. We don't actually register them as a hospital patient because we don't want to make them feel uncomfortable and hesitant to receive that health care. And it's been warmly embraced by the homeless. And so we provide both medical care and mental health services. We now have 5 rural health clinics, Tulare, Woodlake, Lindsay, Exeter, Dinuba, that welcome any and all patients. You can be, homeless, uninsured, a farm worker. We're open week or nights and weekends, and we provide the full gamut of both primary care and specialty care, full access to all the vaccinations and COVID testing, and our rural health clinics have never been busier as a result of it. So. And we are exploring other ways, ways that we can partner with the county. Health and Human Services has been phenomenal to work with throughout this entire pandemic, and looking ways that we can join together to go out into the community, to go, serve people where they live rather than, the traditional making them come in to your facilities. We really need to go to them. One of the things that again, a result of the pandemic that we're exploring is a new concept called hospital at home. And I give Adventist Health a lot of credit for standing this program up, where patients that, may not be of such a high acuity that they require hospitalization in the acute medical center, but they do require that level of inpatient care where they're being seen every day by a doctor and a nurse, and they're being monitored and their vitals and everything. Actually now admitting those patients in their own home, delivering a hospital bed, having a doctor and a nurse assessing them, going to them every day, administering drugs and supplies. And, we actually would have doctors and nurses that are here on site managing the care of the patient, but you're actually able to take care of them in their home, and it actually frees up, bed capacity here. One of the challenges that we still face today, even though our COVID numbers are dropping, we're running more than 100% occupancy right now. Today was a low day where we only had 30 patients in our emergency department that were waiting for a bed to open up. There are days that we've hit 50 and 60 and the hospital is literally full. So that's also, when you talk about the future, if we were to face another pandemic like this, where we thought not too many years ago that California was way overbedded, that there were way too many hospital beds for the future. Boy, did this, teach us a new lesson.
Yeah.
Because every hospital has been running significantly over 100% capacity.
Wow. Yeah. Say, Lolly, gonna try something here. Try to pit a couple of you against each other. What suggestions might you have for Gary or for Doug on how to better reach that vulnerable population that we've been talking about?
Okay, it's a very good question. I've dealt a lot with this question with other agencies.
I've got my pen and paper here, Lolly, to take notes.
Don't worry, Lolly. They don't bruise easy. So go ahead. Let them have it.
Okay, I will. By the way, I admire everybody on this panel, so I won't be strong with you. Okay. It's very hard for me to explain some of the things, but I will try. The politics of what the governor is doing, what the agencies, what the hospital is doing, what the schools are doing, what the county is doing. The people don't know what you guys are doing. Nobody does. Okay. They don't know that the school, I know how hard the schools are working. I know how hard the hospitals are working. And the county, I think we have one of the best county staffs in the state. The staff here has been really incredible. You know, they've been very hardworking, very receptive. Okay, so what can we do? The media, most of the agencies do not have advertising money. And if they do, it's very little. That's what they tell me. And the advertising money has to include different strategies, not only advertisement. It has to be outreach and engagement, personal meetings, going to Superintendent Cardoza's parent meetings. And by the way, in the past, we've worked really well with Racially Unified, with Vanessa Alvarado and Doug over there in that department, Jim Sullivan, with Jim Sullivan and Vanessa Alvarado. I worked for years with them, except right now I haven't. No, Superintendent Cardoza, I have not been working with them right now. Okay. So to me, media, because this is a rural community. It's a rural community. So media plays a major role. Okay. The farm workers do not read. If you send them a flyer home, they will save it because they want the date. But they're not going to read everything that's on it. However, they will listen to the radio, and they will listen to some of the programs on Univision or Telemundo or some of the Spanish-speaking network early in the morning, the early talk show. They will listen in the evenings, on weekends, only Saturdays, part of Saturday, part of Sunday, because they're out. Okay, so to me, media is number one. And it's personal, print media, TV, radio, and the strategy also has to include finding local people they trust in their local communities. Finding those people they trust is really crucial, like their pastors, their priest. If the priest tells them, like in my family, if the priest would tell us, go over here, go get that, we would do it. You know, so religion plays a major part in the outreach and engagement. Everybody, you know, like I wrote a notice, I was listening to some of you. This whole thing requires a village. You know, it requires all of us to participate. It's not only the hospital. Look at what the hospitals are doing. Look at what Superintendent Cardoza just told us. I'm amazed at what they're doing and Tiffany's group. Okay, so, but what about us, the people? And I see some of the questions. What can the people do? Okay, so I'm just telling you what the agencies can do is provide that communication and that inclusion of all languages and cultural appropriateness. But including also, I know that a lot of you do not include religion because of schools or whatever reasons, but we need to do that. We need to include them. And we need to include their comadres and compadres, you know, their godparents. Lots of education. And I mean, not only education in the schools, but among ourselves, us, like me, like, you know, like, where do I get more information? And I read Kawia stuff, I read everybody's things coming out, and we need information. We need to address the barriers, like Superintendent Cardoza mentioned, of the unserved communities. Some of those barriers, there are some agencies in the county that can address them, like the housing, their heating, their cooling, all that, so that they don't get more sick as things like this happen. And some of them are ongoing projects like water in the rural communities, underserved areas. Some of you who can work with these things, they need to be addressed. Like, I don't know if the schools teach children, drink from bottled water, things like that, especially right now during emergency situations. And I know I'm going off a little bit here, but with Tulare County is very poor out there. And I think we used to be number 2 from the bottom. I think Imperial County was number 1 in poverty. I don't know where we're at now, Paul or Tiffany. I don't know if you guys know. But we used to be extremely poor. Okay,
so at least in the bottom 10. So
addressing those barriers that we're all talking about, on an ongoing basis, because this county has other emergencies. We've had the freeze. We've had flooding one time in the early Mart area. We've had some other issues, and so we need some ongoing education. But I see you as the leaders. I see Gary's group and Superintendent and Tiffany's. You are the leaders, and so including the people is very difficult. I know that because the people themselves, ourselves, we get influenced by misinformation. The political parties and all the political parties really upset me, by the way, all of them, because they have been a major factor in providing misinformation to the people, all of them. And I have no idea why the political parties have been involved in here. I mean, the government, the federal government, as far as I'm concerned, this government and the past government that left, they both tried. Okay, they were trying to deal with this pandemic. And like some of you mentioned, we've all been learning together. So I see our big leaders also learning together, but we've got to help. Like, I think in order for Superintendent Cardoza to be successful or productive, that we, the community groups, have to provide some sort of input to them and some sort of help, not only leave you alone. Like, I see Kawia, and I have my 2 neighbors on each side are MDs, and we talk a lot out there when we're taking out the trash in the morning. And I see how hard they're working, and I wonder, like, okay, if I could talk to them more, I would learn a lot more. And they do. They've provided a lot of information to me. So, and I know that we're all busy, but somehow if there was a way we could talk, when we have emergencies like this, the county has they have a community care coalition made up of, I think, 125, Tiffany, groups, something like that. They have a big group. Well, the nonprofits play a major role here. And I think that the nonprofits could have helped more the schools and the hospital. There's a lot of nonprofits in this county, and I used to work for them.
Yeah.
And so, I saw this from the very beginning as an emergency situation. I saw how people were getting sick. I have our neighbors down the street, a beautiful home. They died. Okay. I mean, I'm like devastated. They were like my neighbors for 30 years, and they're not there right now. Their cars are there. Their house is there. They're not there. That really upsets me. Okay. So, things happen.
Yeah. Not everybody saw it as serious as it was going to be at the beginning. And that was a problem. We've got about 20 minutes left. We got questions piling up here from outside that I'm being bugged to ask you folks, and I will. I do also want to end by asking everybody what the average person could do. But first, I need to talk to Tiffany Swartout for a sec. Ask her the same kinds of questions about how your procedures might have changed. Before I ask that question, though, I do want to compliment Tiffany and Tulare County and its Health and Human Services agencies and public health. You folks probably were the best in the state at getting vaccines out to the public, probably the best in the state about getting information out to the public. I know Lolly's correct about communication was a problem, but I thought you did a terrific job. So the credit where credit is due. Tiffany, what procedures or policies might have changed that you've learned about in the last 2 years?
I think that the number one thing is the way that we collaborate with our community-based organizations. Like Lolly said, when we hit that first surge in July of 2019, our agency worked to bring groups to the table to support our community because they were in need. People were out of work, they were isolating, they didn't have food, and that group really stepped up to the plate, and that's our Community Cares Coalition. We learned from the success of that group, who would host testing events, when there were metrics and things like that, that as we began to roll out the vaccine, we needed to bring partners to the table for that. So we had a vaccine advisory committee that included healthcare partners. It included our education partners, as well as some of the larger private employers in the county. So we could figure out the most strategic and effective way to make the vaccines available to those priority groups that were being identified by the CDC, as well as the CDPH, and how we were making the vaccine available. I think that is the way that we will move forward in making our decisions. There are some really exciting initiatives. I oversee a team that works specifically on equity, and we're looking at training some non-traditional community healthcare workers through a grant that we're getting from Anthem. There's a model that is being carried out on the East Coast called Shots at the Shop, and it's where barbers and hairdressers begin to provide health information. So as Lolly said, and I believe Gary and Doug alluded to, trusted messengers are a key for that. And so how do we as the public health department engage others who have not been in that role in the past? Because they will really have the most effect on the people that they have contact with. And it can't always be on the health department, because the long-term consequence, which was something that was asked of the others, is people have trouble trusting government, and public health is part of government. And that is the long-term consequence that public health is going to have to deal with for the next several years, is how do we build trust with our community again? And so one of the ways that we're doing that is building our network of community healthcare workers, strengthening our relationships with community-based organizations, as well as our healthcare partners and educators.
Perfect, Tiffany. You're leading me right into the first question we're getting from our audience, and I think you might be able to see these questions yourselves in the private chat. I'm going to refer to the one, has the hospital and county health officials, okay, that's you, Tiffany, considered how they will handle the long-term health effects, long-haul COVID in the community? And I guess they're referring to, their effects on people who have had the COVID that might not emerge for several months or years, or they might be living with it for a while. How's the public health? How's the health department going to cope with that?
I think one of the struggles is the way that our healthcare system in the nation is built. We don't get data points on everything, right? So it really would have to become something along the lines that is documented by providers like diabetes, and then that infrastructure would have to be there for us to receive that information. And so at this point, I don't know how that would happen. But as the health department, we do community health assessments. We're going through that process right now, as well as community health improvement plans. So what I foresee happening is making that a key part of our education, and working with providers about the long-term outcomes of that. But at this point, we don't really have data points on it. So this is going to be one of those long-term things that is evolving. And like I said earlier, we should have learned earlier on to adapt our messaging, that things are going to change. And I do believe that this will be one of them. But we have to build the system to get that information to inform the work that we do.
Gary, what do you say? How do you respond to that one?
Yeah, so I would say the vast majority of our COVID positive patients, the inpatients, do make a full recovery, but we definitely have seen our share of the long haul survivors. And COVID really, what's been so difficult about this novel, virus is that how it interacts with an individual's unique DNA is very different from patient to patient to patient. How do people that live? I think maybe Tiffany was talking about her children contracting COVID, but she doesn't. I had COVID, and we didn't do any isolation, and my wife didn't get it when I had it. So how is that they have an immunity that other folks don't? So what we're seeing is that COVID is causing serious and long-term heart damage, lung damage. People are permanently losing their senses of taste and smell for years at a time. The brain fog that you hear about. In fact, Dr. Richard Pantera, one of our neurologists, is actually conducting a formal study right now, enrolling patients that have had COVID that have been, haven't been able to shake, the mental, the fog that exists. So I think really what it's going to come down to is those patients that do have those long haul conditions, working with the medical community. I mean, we definitely, if you didn't previously have a cardiologist, didn't have a cardiac problem, but COVID has now caused you to have it, how do we quickly get you into the care of a cardiologist so that, we're now taking care of those new conditions that you have. So Tiffany's right. It's really the whole healthcare community coming together. Definitely, identifying those patients that do have it. And if we can somehow bring that data together and make meaningful use out of it, and and provide the care, the ongoing care that those patients need.
Assembling the data and applying it. Gary, I'll start with you with this last one here, and I'm going to switch it over to Tiffany once you had your say. But from a public health perspective, what's your biggest concern aside from COVID-19?
Yeah, and I really touched on that because the workforce shortage issue existed pre-pandemic. It has only been exponentially exacerbated by the pandemic. But we as a country, and particularly we as the Central Valley, have been suffering through a severe nursing and physician shortage for years. Lolly was commenting on our poverty. We have also some of the worst health factors in all of the 58 counties throughout the state, and we're ranked either number 1 or number 2 at the bottom in terms of the number of primary care physicians per population. So that was already in place before the pandemic, but now again, more and more folks dropping out of it have moved out of the community, moved out of the state. To me, that is the number 1 public health issue, is that we don't have enough healthcare workers to take care of our communities.
Back to you, Tiffany. What do you say to that one?
I agree with Gary. The workforce is a concern, especially in the field specific to public health. We have nurses, NPs, physicians assistants, and doctors similar to hospitals, but health education, people who go into that as their line of work, has been a real challenge for us. We have been really fortunate that the people we have on our teams are very passionate and have stuck it out, but we have seen a high turnover as well. So I just want to add that on to what Gary said, because it is an issue for us, even in the area of education. And then to say that the other one, because it impacts schools, it impacts Lolly's groups that she works with, is equity. We've talked about the technology aspects and how it affects kids when they're having to go to school from home if they don't have good internet access or food security. Also the racial disparities that we've seen of how it impacted people of color, the COVID-19, and access to things like healthcare testing and vaccines. We're really fortunate there's money coming to public health departments now, but pre-COVID, that was not a thing. It was an activity that was part of the public health sector, but we weren't given any money for it. So there's a lot of work to be done there to build that infrastructure to support our communities in relation to equity.
Doug, let me start with you on this question. It was one of the first ones that was directed to us about the announcement from the governor's office today. This question syntax is a little mangled, so let me try to direct something that sounds like a question to you. How will today's announcement from the governor's office that the state is moving from pandemic to endemic affect your response to the COVID-19 pandemic?
Yeah, for schools, it really didn't change anything. We're still under the same mandates and guidelines. So one of the things he did say is on the 28th that he will make some type of announcements regarding some of the changes that will happen for schools. He didn't say when, whether masks will be taken out at that time. So we're kind of in a holding pattern still. So we'll continue down the path we've been traveling here recently. And see where it goes. And we've got systems in place, and we're doing okay, I think. And kids are coming to school. When we go walk on campuses, and that's what I'll take board members and stuff and walk our campuses, so that you can get a sense of how kids are actually doing in school. They're doing great. Kids are doing a good job. They're fun. They're excited. They're enjoying school. Staff is doing a phenomenal job. And so those are the things that kind of keep us centered on really focusing on continuing to do great things for kids and creating a positive environment, because, one of the things that we encountered early on and at our board meetings was all the negativity towards everything was focused on COVID-19 and masks and all those things that were important. They're very important to all of us, but it shifted all the energy and focus away from doing great things for kids. And so that's one of the things I've tried to do is to really highlight the things that are going well in our community with our kids and our families, and keep that in the forefront and continue to work hard and acknowledge the challenges. I believe everyone that stands up in front of on our podium believes and is doing what they think is best for their children, and I respect that. And we've tried to be passionate to that and work closely with all of our people, but really continuing to focus on keeping our schools a positive place for kids and staff to be. And I think that's gone well. So we're going to stay the course.
The situation now in Visalia schools is students and staff are required to wear masks indoors.
Indoors, yeah.
Okay.
And if they, and there's also weekly testing. So for unvaccinated staff, they're testing weekly to.
Okay.
By
the way, let me point out to everybody, and this is Doug, Superintendent Cardoza has kindly offered that website URL that you see on the bottom of your screen for Visalia Unified Students for Homework Resources Help, www.vusd.org, domain /126. So those of you who need to out there, please take advantage of that.
Very good. Hey, I wanted to add one more thing, if you have a quick second.
No, yeah, go ahead.
So, through all of this, we've received a pretty significant amount of funding to increase the number of days in the school year. So we've been tasked to increase the school year by 30 instructional days and increase the instructional day to a 9-hour day. So this is work that's in progress that we need to really connect with our community resources. It's an opportunity to do some things differently with our kids. The 30 extra days will come, during winter break and summer. But there's some flexibility in how we use those funds and the types of opportunities that we can provide for kids. So we're developing a committee to connect with resources that happen before school, after school, within our community, so that we can build this out as a special opportunity for our kids. The only thing that I raise a little caution to is, the idea is that we're providing all this extra time and resources to get kids back up to speed for maybe some of the learning loss. But as a district, it's like the one thing that we can guarantee is that time that we have kids between 8 o'clock and 3 o'clock. And so really it's important to me that we really focus on doing a fantastic job between 8 and 3 when we know we have all kids, because we can't guarantee that all kids are going, because it's an optional, the extra 30
The
days
extra is going to be optional.
before school and after school. So this is my 33rd year in education, and we've always had opportunities before and after school and sometimes on weekends, but it didn't get all the kids all the time. There were some access issues. So as we do this, we really have to think about it and do a good job. You know, I took lots of notes here regarding access and how we support our underprivileged communities. And so I appreciate all the media part of that, how we reach out to people. And I put another link in about our family and community resources. I think it was Lolly, she mentioned that she had worked with Jim Sullivan.
It's it's in the chat room out there, folks. If you and it's the USD.org page /19288. But you can get that and click on it and get right to that link.
Yeah.
And Doug, I hope that is good news. Thank you for sharing that. I hope you've had a chance to share, everything that you needed to tonight with that. I want to go just one more round here because we've run out of time, but there was a question for Lolly, and I'm going to extend that to everybody. But first of all, thank you for all your work, Lolly. Someone thank you. That's nice because not everybody does. What can people do to help get vaccines? What can people do to help get vaccines out to the outlying parts of the county? And this goes to our final question. What can ordinary people do to help going forward here? What in your work can they do, Lolly?
Okay, what I have found that works for me is to encourage people to take care of their family on a personal basis. And we also have to start by taking care of our own families. And we start with our own and we move with our neighborhoods. But the encouragement is needed by everyone, and being positive and supportive instead of critical of the schools, of the hospital, of the county, too much of negative energy that we don't need. We need to be more productive. Like if Superintendent Cardoso needs some help, let's offer it instead of criticizing it. And so I'm always ready to do that, and I've been doing that for a while. But people need to be positive about things, helpful, and also be respectful of businesses. I was in a business yesterday where several people were actually sick from COVID, and they were inside the store, the couple and an older son. And I asked them, what are you guys doing here? They said, well, we came to shop. Well, the business, please, there's so many people in here, it's a grocery store. I was kind of concerned about that. I think we need to respect the agencies when they tell us that if we're sick, we stay home. And it is serious to do that, very serious. And especially if you don't want to wear a mask, you don't want to do your vaccine, that's fine. You don't want to do that. But please respect others and respect the businesses, the schools, the students, the people in all your areas. If we all do our part, like I said a while ago, it takes a village. It's not just the hospital. The hospital is not just going to get somebody well. The hospital needs help so that you don't get in there. I mean, they already have their hands full with normal illnesses.
I think that reminder about respect, Lolly, is a good one, and it's too seldom reminded too about respect for everybody in these situations.
We have to respect each other, and
Gary.
Okay, so thank you guys, everybody.
Gary Herbst, what kind of advice to the average person what they can do?
Yeah, so Paul, my go-to answer is always get vaccinated. Because it really does work. I can tell you that the vast majority of patients that have been admitted to the hospital with COVID, or that end up in the ICU, or sadly end up passing away from COVID, the vast majority are unvaccinated. So the vaccines absolutely do work. But my new answer is actually to maybe rethink your own personal lifestyle. If you're able to get healthier, to eat better, to exercise to boost your immune system. Again, probably 80 to 90% of the COVID positive patients that ended up in the hospital and ended up passing away from COVID generally had a pretty serious underlying comorbidity. They were either overweight, obese, or had uncontrolled hypertension or diabetes or other underlying comorbid conditions that can be effectively taken care of. And so that's my new go-to answer, because I'm kind of, trying to convince people to get vaccinated. I don't really want to harp on that anymore. But people can definitely take better care of themselves and get that immune system up, and that will go a long way.
Excellent. Thanks, Gary. Yeah, it starts at home. Take care of yourself. Doug, anything else about what people can do on a individual basis to help?
Yeah, I appreciate what Lolly says, and I think it's a lot of what she said is a lot of what we need to do. Is the one thing that I can ask people to do is reach out and talk to people. I've found that I pick up the phone and call people rather than try to communicate through email or on a text message. And when you sit down, you just talk to people, we kind of end up in a good place, and people understand we're all in this together. So I encourage them to reach out, and families that are concerned about things at their school, reach out and talk to the teacher or talk to the principal, but reach out and talk to them, and as a person, and it makes a big difference. So we're going to get through this. I have confidence in that. Things are getting better. But I think the power of building those relationships is going to get us through this and help us move forward in the future.
Wow, that's great. Finally, we're going to give you the last word, Tiffany. Unfortunately, your fellow panelists have already taken all the good advice, I think. But what can you add to that?
Yeah, I think it's kind of a collective of what everyone has said. And, we hear a lot in the media that everyone's mental health has been compromised. So I just want to encourage everyone to practice empathy and listening to others, being respectful of everyone, getting tested if you're not feeling well, staying home, those types of things. They all play into what Doug, Gary, and Lolly shared, because there are other parts of our lives that have been impacted by COVID. So I just want to encourage everyone to be empathetic as we re-enter California under the smarter model that the governor announced today. And hopefully we'll see more people get vaccinated and be testing regularly to protect themselves, their loved ones, students, and coworkers.
Great advice from you all. Empathy, respect, communication, and be good to yourself. I want to thank our 4 panelists tonight for being good to us and giving up an evening of their time to share these thoughts here about COVID. I really appreciate it. It was above and beyond the call of duty. Tiffany Swartout, Doug Cardoza, Gary Herbst, Lala Mahano, thank you all very, very much. Our audience, note again that Superintendent Cardoza left those 2 links in the chat room for help for you and your students. I want to finally thank First Presbyterian Church again for co-sponsoring Tulare County Voices at 210. And of course, the Visalia Times Delta and my old buddy Jim Ward for their work tonight, and our entire Tulare County Voices at 210 committee for putting together this program and helping us out. Thank you all very much. We are concluded tonight. Keep an eye out on the Times Delta for our forums, times, dates, and subject for next month. And I will see you then, I hope. My name again is Paul Hurley. I want to thank you very much. Good evening.
Bye, Tiffany. Bye, Gary. Bye.
Bye, Lolly. Bye, everyone.
Bye.